Every cell in our body is a purity God desires. Every organ in our body is an organ of divine fire. Every organ in our body is a purity God desires. Uterus is the organ of divine fire. Uterus is the purity God desires. Today, we will come to know about our female reproductive organ, uterus. In the human body, there are many wonderful organs from the top to the bottom of our body, like brain, heart, lungs, stomach, small intestine, large intestine, kidneys, five sense organs, the largest skin organ, skin, all are there. Uterus is located in the lower pelvic cavity of our body. Uterus is our female reproductive organ, which helps a lot and gives troubles from teens to the old age. Ladies go through this many complications throughout the life. In each stage, according to the age, may have PCOS, PCOD, that means polycystic ovary syndrome, and polycystic ovary disease, fibroids, chocolate cyst, abnormal endometrium ball growth, infertility, miscarriages, bulky uterus, cervical and ovarian cancer, and uterus prolapse, etc. Nowadays, many young girls are having PCOS and fibroids. Very surprised to know that young girls, college going girls, school going girls also having this PCOS and fibroids. Main reason for these complications are, main thing is the wrong way of breathing. All are doing wrong way. Ulta breathing, shallow breathing, and less physical activities also. Eating junk foods at night times and consuming medicines for skipping or postponing the periods to attend family and temple functions. So there's a change in the period cycle. Due to the lack of knowledge, we are consuming these hormonal tablets, which will skip the periods or postpone the periods and creates hormonal imbalance and brings the problem. Our beloved Dr. Siva sir knows the difficulty of women going through the life, and he gives more and more importance to the women. Kind-hearted Shiva sir, like a mother with love and affection, ask us to heal the women going through this severe pain, heavy bleeding, excessive bleeding twice a day. He asks us to heal them twice a day. He has specially energized our wants to do so. Siva sir, thank you, sir. Thank you, thank you, thank you. Next, ma. Uterus. Now we will come to know about our female organ, reproductive organ, uterus. Where it is located? Uterus is located in the lower pelvic cavity between the urinary bladder and the rectum. It is a hollow, pear-shaped, bulb-like organ in size of a fist only. Like this is only, it will be small. With the slight forward tilt. It is like that. Rarely, some may have heart-shaped bicornate uterus. Some will have T-shaped uterus. Some will have the uterus tilted backside also. Some may have double uterus also, where two separate uterine horns develop. These are caused by the structural differences present at the birth, caused by the issues during the development of womb uterus is supported by the ligaments, pelvic floor muscles, and perineal muscles. On the top, it has a two horn like a shape that is called fallopian tube. On the fallopian tubes are connected with the ovaries on the other side of the fallopian tube. A healthy uterus is a regular, pain-free periods, normal discharge without pressure or pelvic pain with mild cramps. And the cycle will be occur every 21 to 35 days. Regularly it has to happen. Usually there will be a clear or white discharge without foul smell. That is called healthy uterus. A healthy and strong uterus plays a key role in fertility, in pregnancy, and overall well-being. Main now for this, eating healthy diet like iron, calcium, fiber-rich foods like leafy greens, whole grains, beans, lentils, avocados, flax seeds, chia seeds support hormonal balance and reduce inflammation. Drinking enough water also is good to maintain the good blood circulation. Gentle physical activities like yoga, walking improves the uterine health. Mainly the high stress will definitely affect the hormones. When you say the words like fear, scare, worried, stress, tension, we are definitely worsening the situations. Always be positive, think good for us and think good for all. Next, Kana, functions of the ovary. What the ovaries do? These are the two ovaries at the both sides of the uterus. It is a small in size and shape of an almond nut. These are responsible for producing eggs, female hormones like estrogen, progesterone. This plays a crucial role in menstruation, pregnancy, and menopause. At the bottom of the cervix, there is a bottom of the ovary is the cervix, which is the mouth of uterus that leads down to our vagina. What will happen? How a baby is formed will come during the relationship. The sperm in vagina swims into through this cervix. By the time a egg is released from one of the ovaries and travels to the fallopian tube. The sperm in the vagina swings, travels through the cervix and into the uterus, aiming to reach the egg in the fallopian tube. If the sperm fertilizes the egg, it goes in the fallopian tube. The fertilization happens and egg undergoes rapid cell division and it travels down the fallopian tube towards the uterus. Once the embryo reaches the uterus, it implants itself into the uterine lining called endometrial growth on the sides of the uterus. Sides, it may be in the sides, upper fundus or lower. Anyway, it implants itself. For successful implantation, the thickness of the endometrium must be between 8 m to 12 mm. This is very important for the embryo to progress normally. Here it will continue to grow and develop. After 5 days of implantation, the cells becomes the fetus and placenta begins to develop and the pregnancy hormone, which is called HCG, starts to produce. Heart is the first organ to start working and fetus begins to grow. Now, Kana, next. Now we'll come to know about the complications that will happen. Endometrium. Regular gynecologist checkup are very, very important for maintaining any potential issues early itself. Abnormal vaginal bleeding, infertility, pelvic pressure, or pain can be cause of the growth of endometrium. It is the lining of uterus which thickens in the preparation for the pregnancy. Embryo implants itself on the lining. If the pregnancy doesn't occur, the lining sheds down as a menses period. Normal range of the thickness will be 2 to 4 mm in teens, and during the ovulation it increased to 5 to 7 and can reach up to 11 also, and increasing up to 15 mm also. During the pre-menopause, the thickness will decrease less than 5, and when this thickness tends to decrease with age, after menopause is not good. When it goes very thin or grows very thick also, it is not good. So you have to go for the further examination. Adequate thickness is a key factor for the supporting a healthy pregnancy. When the wall becomes thin or thick, we have to go consult a gynecologist so that they will do scans and find the problem. Next, fibroids. Other problem is fibroids. Now, teenage girls all are and above 30, 40 also having the fibroids. What are fibroids? Fibroids are non-cancerous growth made up of smooth muscle cells in the uterus. Hormones like estrogen, progesterone, which regulate the menstrual cycle, play a significant role in the fibroid development. Day by day, it grows in the inner wall of the uterus. It may be in the anterior, posterior, any at the bottom also it happens. It grows. Mostly the many girls are having during the pregnancy also these fibroids, because of the hormones, the fibroids grow more. To maintain that fibroids, many gynecologists will send many ladies to me to maintain that fibroid development. When they do come full breathing exercises and all, the development, the growth will be subsided, and some may decrease also. So breathing is very, very important in the development for the fibroids. Now, these also factors, we don't know that the exact cause for this, but several factors like genetics, hormones, lifestyle factors, estrogen, progesterone matters, and uterine lining also thickens for the fibroid growth. Now we'll come to know about polycystic ovary syndrome. This is an hormonal disorder. This also all because of the hormones only all are happening. This also a hormonal disorder causing small cyst on the outer or in the inner edges of the ovaries. Some will be a chocolate cyst, fluid filled sacs. Some will be solid filled sacs. The main reason is the lack of iodine and zinc, and mainly artificial sweeteners are using for the sweets and snacks. Then and proper blood, not there's no proper blood circulation. Also, this PCOS happens. Now, Kana, next one, cyst. This also polycystic ovaries disease. This is the disease not able to produce eggs and not able to produce estrogen and progesterone. It will release, what it will happen no, when the both are not happening, it will release androgen and the male hormone, which and insulin resistance also. Because secretion of male hormones, many ladies will be having hair growth on the face, on like a dadi it will come. This is due to this ovary disease only. And because of the insulin resistance, many doctors will prescribe glycomet, metformin like that to reduce it. But proper exercises, deep breathing will help them a lot. Now we'll come to know about the premenopause. That is called PMS. Easier they are saying, but very, very hard to tackle it. This may begin as much as 35 years, 8 to 10 years before the menopause. These brings this also the estrogen, our female hormone, estrogen start to decrease. There will be a physical symptoms like irregular periods, skipping periods, sometimes light or heavy mood swings, night sweating, sleepless night, dryness of vagina, so discomfort during the sex. This all happens, and moreover, the breast soreness will be there and feeling very, very gassy and all. There are more emotional symptoms also, like mood swings, anxiety, depression, brain fog, sad, or always having the tendency to cry, crying spells, like that it happens. A week before the menses time, you will have these symptoms. For this also, lifestyle adjustment with the family, with the husband and the family is very, very important. Regular exercise, walking, calcium, fiber-rich foods, deep breathing exercises can manage the emotional symptoms. First of all, we have to accept it. I am deeply, completely, and consciously accepting my pre-menopause. Like that, you go on saying it and do healing and all. It will be little better. Next, we'll come to know about the menopause, big one happening in our life. When the when the ovaries stop producing hormones, periods stop for good, well and good, very happy. A natural decline in the reproductive hormones. When the woman reaches 50 or 55, it happens. The period stop for all, well and good. But common symptoms include more, again, hot flashes, sleepless nights, vaginal dryness, same thing, anxiety, depression, all happens. Here, estrogen plays a major role in preserving the bones also. So what will happen now? Osteoporosis may occur. What is that? Because the bones have will be very less dense and fragile and lead to fractures. So when you sit or you walk, the bone may crack. That is called because of the less production of estrogen. Very, very important. Our Siva sir have said to expose to sun and ask prana from the sun. Exposing sun is the best remedy for this. And same thing, eating healthy food, regular exercises, and deep breathing exercises will help a lot. Then comes the bulky uterus. What is that? Bulky uterus is called adenomyosis. When the endometrial wall thickens more, that means above 15, that means 15, 20, 25, and this happens. The when the wall thickens, there will be a bulb enlargement in the ovary, in the uterus. So this also have to take medicines. Apart from that, you have to do more breathing, more exercises will give remedy. But during this menopause time also, after a long time, many some will be getting fresh spotting or bleeding happens. Don't hesitate to go to the gynecologist, have a test because immediately, because it may be the growth of cancerous cells. Have the treatment, don't delay. Consuming very little amount of rice, wheat, sugar, tamarind, oil is good for the health. Then Kana, next. Menopause. Then next ma, what how the menopause affects the body? It affects all physical and emotional. Also, it affects like brain fog, depression, anxiety, dryness of dryness of eyes and mouth. Also, then sexual dysfunction and weight gain, bone loss, that is osteoporosis, heart flashes, and thinning of the hair. There will be a heavy fall in the hair. It all happens because of the menopause. Okay. Now, Kana, we will know. We know. We have studied everything about this. All happened because of the hormones only. Spending and wasting time and money on the hospital appointments and visits and repeated various scans, hormonal therapy. Better to have a quick and easy way to handle these complications and have a healthy body is to follow the protocols of PVH, doing bed yoga daily with the and the balance breathing with Sivasar and toning the pelvic floor muscles with helps a lot. Instead of wasting the time, we can do it in the morning with Sivasar and get great relief. Our Sivasar has blessed us a magical tool, wand, which does miracles in the healing our body. More often do aura cleansing, Ida Pingala, Shushna balancing, and heal and condition all chakras, organs, endocrine glands. The main theme is master glands are endocrine glands. They produce more and more hormones which are necessary for our overall health also. Then sitting in the daily healing day and blessing and Sunday calendar blessing with Sivasar will remove the connection from the inner world and place of worship. Easy way we can spend it and we can do it and we have a healthy, happy life.